All right, well, thank you again for coming. So we're going to be talking about speech therapy related to Parkinson's disease today. And I want to just start with a real brief overview of what Parkinson's is, and then back up just a little bit to how it affects the body, which maybe you're already aware of, but I just want to make sure that we're all on the same page before we get going into how the speech stuff works. So it's a progressive neurological disorder that affects movement, characterized by the degeneration of neurons that produce the neurotransmitter dopamine. So degeneration of the neurons means that there's less dopamine being produced, and this can cause the tremors and the movement issues, as well as balance problems that can result in some cognitive changes, as well as sleep and sensory issues. So backing up to the beginning, so how does the brain communicate with the body? Through neurons, which are like the electrical wiring in your brain that send out the message to the muscles to do what they do. It also uses nerves, so the neurons are in the central nervous system, which is the brain and spinal cord, and then the neurons are what is conducting the actual message out to the muscles. So neurons are more centrally located, and neurons are more centrally located, and nerves are more peripheral. The messages are sent using chemicals called neurotransmitters, which are produced in the synapse, or the little space in between one nerve or neuron and the next. They're very specific on how they send their messages, and they only can signal certain pathways. So this picture down here at the bottom shows the dopamine, which is specifically related to Parkinson's, and how it kind of gets dumped out into this synaptic cleft, which is that space in between the two neurons or nerves, and then there are very specific receptors they show them as shapes, which obviously, like, these are tiny chemicals, so it doesn't look exactly like this, but only certain neurotransmitters can signal certain nerves or neurons. And there's a minimum threshold for how much neurotransmitter is required in order for that signal to be sent. It's called an action potential, if you're familiar with any of this. So if there's only a little bit of the neurotransmitter that gets produced and put into that space, it may not meet the threshold to actually make the movement happen. And if there's too much that gets sent, it might make the movement too big or too strong. So dopamine in the brain functions as the neurotransmitter. It initiates the messages that are sent out to the body. Outside of the brain, it acts like a hormone, which impacts how different body systems work. So it impacts the reward and the pleasure system. It impacts motivation, movement control, cognition and attention, emotion, sleep and wakefulness cycle, learning and adapting to new situations, vasodilation and constriction, so how big or small your vessels are for blood, and then your electrolyte balance, immune system activity, and metabolism. Do you have any questions about any of those things before I move on? It's a long list.
Yeah.
Okay. So if it's imbalanced and there isn't enough, it can result in fatigue, lack of motivation, trouble with focus, and then the movement disorders. And also, if it's too high, then you can have impulsivity and aggression, and this, again, movement disorders, but just in the other direction. So if we're going to talk about more specific to communication, Parkinson's disease impacts the neurons that create the dopamine, resulting in less production. So that causes the change in the brain involving the muscle movement. And the most common issues that we see in speech are soft voice, hoarseness in the voice, monotone speech, and kind of a mumbled quality of the speech. And that's primarily because the movement isn't big enough. So all of our speech is the result of muscle movements. And we learn how to talk when we're little. And our body knows to send a certain signal to get your tongue to a certain place. or to make your vocal cords move together to a certain degree. And if you're not getting enough of the dopamine to cause that signal to be the same strength that it's been for your whole life, then the movements are smaller than they used to be, which causes that softer voice, maybe the hoarseness, and then kind of the mumbled quality. So this is a beautiful image that kind of depicts that same thing that I just explained, right? So you feel like you're speaking at the same level that you've been speaking at forever, but other people perceive that as being soft or very soft in volume. And when you speak at a loudness that's normal, it feels like, so like you're moving up 2 levels, it feels like it's too loud. It feels like you're shouting. So part of, let me not get ahead of myself here. So this is how it looks for someone in real life who's dealing with Parkinson's, is it feels like you're speaking at the same level, at the same rate, with the same precision that you have been forever, but the perception of the person listening is that it's not the same, which is so frustrating, right? Because you're like, why can't you understand me? Or why can't you hear me? I'm talking just like I always have. So part of the speech therapy then is to, they call it recalibrate. So it's like setting the new normal in your brain of actually we need to put in a little bit more work to get the same result that we had before. So it improves communication by helping the person with Parkinson's speak with a voice and a volume that's easier for others to understand. It's built on very specific exercises that are designed to strengthen the larynx, which is the anatomical term for your voice box, and all of the other muscles in the speech system, including the muscles of respiration. So it's working on breathing properly and then using all of these muscles properly so that you're not causing damage to your voice, and also are able to optimize the muscle strength that you have. It focuses on vocal loudness, and the research shows that the treatment can also help with other things, including that precision of articulation, intonation, which is the raising and lowering of the pitch of your voice, and even facial expression. So what is it like to do the LSVT, Lee Silverman voice therapy? We start with a comprehensive assessment, measuring your loudness, measuring how well you can be understood. The assessment even includes things like what happens to your voice when you're doing something else while you're talking, because that dividing your focus between speaking and doing something often results in your voice falling off more than it does when you're just thinking about talking. And from that we establish, like, where are you at the beginning and what are some goals that are reasonable for us to try to accomplish by the end. It's a pretty intensive program, so it's 4 weeks, and you come 4 days each week for therapy, so a total of 16 visits in a month. And each of those visits are an hour. And then outside of your therapy sessions, you do some homework at home each day, which the homework continues forever. It's just like any other exercise program, you have to keep using it or you lose it. So after that month, it's pretty amazing what a change happens for people. But oftentimes people will come back for a tune-up here and there, you know, but they don't need to do the entire program again. They just need a little reminder of the different components and maybe a little encouragement to keep practicing at home. So this is Shirley. Shirley is like the poster child for this program. I just wanted to show you a little video of how she looked before versus after.
Any changes in your speech or your voice? that you would associate with Parkinson?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Anything else?
I stutter, which I never did before.
Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Son of the Pioneers one of these days with my
Good for you. That's excellent. Has anyone commented that it's easier to understand you now?
Oh, yes, I sent some of our friends back when we went to their house and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
What do you do when you want to be as easy to understand as possible?
Think loud.
Did you find the speech therapy beneficial?
Very.
What were the changes you noticed right after speech therapy?
My voice was stronger and it was louder.
And we said you've been practicing. How often do you practice?
Oh, about 5 times a week.
Do you really?
Mm-hmm. When I
Surely.
have nothing to do, I just something to chin and go,
That is phenomenal. And have you done that like ever since we ended speech treatment? So do you feel like practice helps?
oh yeah.
Any great pearls of wisdom you have to offer the world, Shirley, about communication and Parkinson's disease?
Well, if you don't talk loud, nobody wants to hear you. They won't straighten themselves. So you have to talk loud to be heard. And once you are heard, everybody wants to talk to you.
So I think the most impressive part of this is that 8 years later, she still has a nice, clear, strong voice because she continued to do the work. Anything can work for a short few weeks or months, but the fact that it shows 8 years later that she still has a nice, strong voice is pretty great. So that's all that I have for the formal presentation. Do you have questions for me about Parkinson's or other speech therapy related things? They make like a beautiful little wave. I don't know if you've ever seen a video of how the voice works, but it's really kind of cool. But it makes this wave that looks kind of like this, like how my fingers are going. But the full surface of the vocal cords needs to make contact in order for the voice to be clear. When it doesn't fully make contact, there's little air leaks. And that's what causes the hoarseness. So you've got little bits of air that are coming out and you can't have that fullness because the vocal cords are never fully, completely touching each other. There are multiple reasons that that could happen. So there's atrophy of the muscles. So as we age, our muscles are not as bulky, just in general. But if you're not using your muscle to its full capacity, you get disuse atrophy, right? Are you familiar with that terminology?
Atrophy, yeah.
Yeah, so disuse atrophy is what happens when you don't fully use your muscle. So like if you've ever been sick for a few days and laid in bed and you get up and you're like, oh, I can't even walk down the stairs. That's disuse atrophy, and it happens really fast, regardless of our age. But if we're not fully using our vocal cords, you can have a little bit of thinning of the muscles. And then you couple that with the message that's being sent isn't strong enough to really make them fully work. And you have the perfect storm to create hoarseness. So the cool thing about the exercise program is it will bulk up those vocal cord muscles because you're exercising them, you're making them work, and also it's then making the message get sent stronger so that you're sending the full message to fully make contact and you're bulking the muscles so there's no air escape because of the disuse atrophy or atrophy in general. So the hoarseness goes away pretty fast usually for people because of those two components that we're addressing with the therapy program. So again, you can see we're waiting will make it harder because those muscles are going to get smaller and the message is getting sent less, and so there's more air escape, and then you're not getting, it's this like cycle of badness, right? Like where it just keeps getting harder and worse because the message isn't getting sent strong enough and the muscles aren't getting used quite enough, and so they keep getting just a little bit less strong because they don't have to work. So I'm gonna just adjust to the new expectation of me. And then when you do try to make them work, it's a bigger uphill battle to get back to where you want to be.